Now you'll learn how to perform a patient test using the ITC Hemochron Signature Elite. You'll see how Elite reduces errors due to operator technique and gives you fast, accurate results right at the patient's side. First, we'll look at the features of the Hemochron Junior cuvettes. Then, you'll get an overview of Elite's test process. Finally, you'll learn how to perform a test. Elite uses Hemochron Junior low blood volume microsample testing cuvettes. The broad testing array includes fresh whole blood tests for ACT+, ACT low range, PT, and APTT, as well as PT and APTT tests for citrated whole blood. Hemochron Junior cuvettes are packaged individually and can be stored for up to 12 weeks at room temperature, making them easy to store on the floors. If the cuvettes have been refrigerated, they must be brought to room temperature before use. Note that the cuvettes are individually pouched, and each pouch provides the test type, lot number, and expiration date. This information can also be easily scanned into Elite using the barcode on the pouch. When you are ready to test, open the cuvette using the Tear tab on the pouch. If you look closely at a cuvette, you'll see that it has two channels, the test channel and the waste channel. The Hemochron Junior cuvettes mimic the capillary action of the body by pumping the blood back and forth over a restriction in the test channel until an endpoint clot is formed. The cuvette's sample well holds less than 50 microliters of blood, and this small sample volume supports blood conservation protocols. When the Start button is pressed, Elite automatically draws exactly 15 microliters of blood from the sample well into the test channel. Excess is drawn into the waste channel, reducing biohazards. Errors due to operator technique are reduced because the instrument draws the precise amount of sample needed. Now, let's perform a patient test. Remember to follow whole blood sample collection procedures per Clinical and Laboratory Standards Institute guidelines and the Hemochron cuvette package insert whenever you perform a test using Elite. First, ensure that the prompt line displays Insert Cuvette. Insert the cuvette for the appropriate test. Elite will automatically recognize and display the cuvette type. The cuvette will warm to body temperature. At this point, cuvette lot and expiration information, or patient and operator IDs, can be entered. If this information is required, Elite will request them in the prompt line. If the instrument is configured for manual entry, at this time you can enter the information manually. To enter IDs, press ID and select 2 to enter an operator ID. If the instrument is configured for scanning, press Print Scan and hold the barcode 4 inches from the barcode scanner. You will hear a beep when the data has been stored. Scan the patient ID the same way, selecting 1 for patient ID. Once the cuvette is warmed, Elite begins a countdown. You now have 5 minutes to take and apply your sample. When you have taken your sample, add a drop of blood to the sample well. Fill the sample well from the bottom up and add enough blood so that the lower wall of the sample well is completely filled. You need a level sample with no dips or domes. If any blood extends above the wall, push the excess into the overflow area. After you have added the sample, press Start. Elite automatically draws the sample and any excess into the device. As the test begins, you'll see the count displayed on the screen. When running the ACT Plus test, only Hemochron Junior offers an accelerated count, reducing test time by as much as 1/2. The result is that Hemochron Junior ACT Plus tests can be completed in 4 minutes or less, and the clinical team can move on to the next step of surgery more quickly. When the test is complete, the clotting time will stay on the screen until you remove the cuvette. Verify that the test results are within expected values and document the test results according to your institution's protocol. That's all there is to it. In just a few minutes, you've learned how to perform a patient test using the Hemochron Signature Elite. You also learned more about the Hemochron Junior Cuvettes and how Elite gives you fast, accurate results right at the patient's side.